right, Sarah, before we begin, I just wanted to check with your pain. So from a scale of 1 to 10, what would you say is your pain today?
It's around a 5.
Okay, a 5. And where does it hurt the most?
In this area right here.
Okay, so the incision site. Okay, well, you've only had surgery, a week and a half ago, so it's very, very normal for clients to feel a little bit sore. But good news, that will eventually go away. All right, so the doctor's orders for, transplant surgery is that you refrain from submerging yourself in water for the first 2 weeks. So that means no taking baths, no swimming, etc. Until the doctor clears, and then when he or she gets those staples removed, that's when you can start taking baths again. So for the time being, we are going to work on showering. And when you're at home, what problems do you mainly have with showering, would you say?
Probably bending and just always feeling tired.
Tired and problems with bending?
Yeah.
When you're bending, is it the pain that makes it difficult? Or?
Yeah, it's the pain.
Okay. So very common again for pain, especially when you're bending and then coming back, that's exerting your muscles. So for the fatigue, does your normal bathroom have a seat or a device like this?
Yes, it does.
Perfect. So the first month or so, I would recommend that you do all showering activities seated and using this.
Okay.
And then for bending, what I recommend to my clients is a long-handled loofah or sponge. And this basically just reaches all the way down to your feet even, and your lower back, and prevents you from having to bend over. Do you feel any more pain when you're using this?
No extra pain at all.
Okay, perfect. So we can probably look into getting you one of these for when you go home. Second thing I want to address is just incision care. So now that you are, taking your own showers, it's very important that you keep that area clean and you inspect it daily. So what I just gave you is a soft sponge. Some loofahs can be a little bit rough on the skin, and because your nerves are severed during surgery, you might have lack of sensation in that area. So using something more gentler is what I recommend.
Okay.
And don't use hydrogen peroxide. When you're showering, always testing the temperature on your hand before you wash that incision area. All of those things are very important. And then most important thing for last is I want you to inspect your incision every single day with a mirror, checking for pus, checking for redness, swelling, any of that stuff. If you see something different, contact your doctor, okay?
Okay.
Okay.
Thank you.
And do you remember your other incision precautions?
Yeah, the doctor said no strenuous activity and no lifting more than 10 pounds.
Perfect, you got it right on the dot. So when we're showering, sometimes our shampoo bottles that come in kind of bulky packages like this, these can be, quite heavy, and you said you're already experiencing fatigue. So something like this, probably isn't the best idea. I would recommend that you get, if you don't have already, pumps that you can fill, with your favorite shampoo. And this would prevent you from having to, use your arms, exert your muscles. So I would recommend getting that. And then lastly, I know this is a lot, but I have this handout for you that basically goes over everything that we just talked about. So you can take this with you and review it when you get home. And just let me know if you have any questions, and feel free to contact me anytime.
Okay, thank you.
Thank you. Okay.